You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani, and welcome back to Beyond Wellness Radio. Today I have a treat for all of our listeners. Today we have Scott Forsgren, otherwise known as the Better Health Guy. And I'm pretty sure Scott's site is betterhealthguy.com. Is that correct, Scott?
That's right, Dr. Justin.
All right, great. So Scott is, I would consider, one of the most premier experts on Lyme disease as well as co-infections that coordinate or kind of come with Lyme disease. And Scott's going to break down some of these different conditions, what to look out for, testing, supplements. Scott's been dealing with his own Lyme/co-infection issues for almost 20 years. So he's really researched it, seen some of the best doctors in the world, gotten the best treatment. He knows what's worked for him, what's worked for the patients that he sees now. And I think he can provide just a really excellent perspective that most other people maybe have never heard before. So Scott, welcome to the show.
Thanks so much, Dr. Justin. Good to be here.
Awesome. So Scott, can you just share your story with all of our listeners? It's very unique. You dealt with Lyme's almost 20 years ago, and you kind of jumped right into the trenches, saw lots of practitioners, did lots of things. Can you outline your story for everyone?
Sure. So my story started in Northern California in 1996, where I had a tick bite in Sea Ranch, California. And of course, Lyme disease at the time, everyone thought doesn't exist in California, and so no one really thought anything about it. And then in 1997, everything pretty much fell apart. It started off in one weekend where it felt like a really significant flu. I had burning sensations throughout my entire body. And those symptoms just continued to get worse and worse. Some of the most significant ones being some of the neurological symptoms, like burning sensations from head to toe that lasted 24 hours a day, a fever that went on for over a year, muscle pain, joint pain, digestive problems. I mean, there's a huge list of things that can be associated with Lyme disease, and I would say that I experienced probably the majority of them. And it took about 8 years before the first person ever mentioned Lyme disease as a possibility. So I was pretty much bedridden for the first 4 years. I would say I probably spent 12 to 16 hours a day in bed during the first 4 years.
Wow.
I then had a reasonable period of what I thought was being back to a fairly good, stable place, not knowing then that it was in fact Lyme disease. And so from about 2000 to 2004, things weren't perfect, but they were certainly pretty good. I was functioning well, working full-time, doing all of those things. And then in 2004, pretty much overnight, the symptoms came back on again with the burning sensations. And I would say that the second time around was as bad as the first. Fortunately, I kind of hit the reset button and found some new doctors. They really had no idea. And at this point, this was already probably 50 doctors, neurologists and every other specialty that I had been to, folks at some of the best medical institutions that really had no idea what might be wrong other than, being a psychosomatic stress-induced kind of illness, which I knew that It wasn't. But, after so many people tell you that's what it is, you do kind of question yourself and wonder, are you really creating all these things, which, I didn't think that I was. And so in 2005, someone finally suggested that I work with a practitioner that does a form of energetic testing called electroacupuncture according to Vol, or electrodermal screening, which is not really a conventional tool, but it is a tool that can give people some insight. I know you're familiar with various forms of kinesiology. And so that person was kind of tasked with identifying the foods that were triggering my symptoms, and then I was supposed to avoid all of those foods, and that was supposed to be the fix. And fortunately, that person, who at the time worked in an outlet mall next to a Starbucks coffee shop and had this computer that made all kinds of interesting noises for an hour, was the first person that said, I think you should really go back and have your doctor test you for Borrelia, which is the main causative agent in Lyme disease, for Babesia, for Bartonella, and for Ehrlichia. And those are three of the co-infections that can come with Lyme disease. There are certainly others. And so I kind of walked walked out of that session with that practitioner thinking, this is a little bit odd. I wasn't really rushing back to the doctor because I wasn't sure that I believed what they had come up with. And so she kept kind of urging me, you really need to go get tested. So I went back and we did a round of IGeneX testing and some other testing. And it definitely revealed some of the things that she had found. And then as we retested over the course of the next 6 to 12 months, we ended up having positive tests for the co-infections and indications for Borrelia as well. So it was really interesting. At that time, the doctor that I was working with said, it's interesting because I do treat a lot of people with Lyme, and you have a lot of the symptoms of Lyme, and I'm not sure why I didn't connect the dots, at that point in time. But fortunately, this lady who had a very unique kind of off the beaten path way of evaluating the stressors in the body was the first one that mentioned Lyme disease. And then I went many other places after that to try to find, treatment and such. But it was, it's definitely something that took me in my prime, a couple of years after I had gotten out of college and was just starting into my career and had never really had any significant health problems, and, completely knocks you down to the point that, you're not really sure if you will survive it or can continue, struggling through the pain of the disease for another day. So it definitely takes you to your lowest, darkest place, and then the challenge and the beauty is trying to find your way back and reinventing yourself and coming back with a different perspective about the world.
So regarding your health at the time, you were like, what, 21, 22?
When it started, I was 25.
25. And how was your health then? Like, were you eating well? Were you sleeping well? Were you managing stress in your life? How was your overall health?
Well, it's an interesting question because I would say that the majority of people that I connect with that are dealing with Lyme were type A plus personalities. So it's pretty rare that you find a person with Lyme that was a really chill, kind of relaxed, character. So, no, I had a lot of, type A. It's not even tendencies. I mean, that's really an understatement. I definitely was type A. I was always the A student. I had lots of emotional stress growing up as a child. Right. I had a number of things that kind of set the stage for, adrenal challenges that then affect my immune system along with the stress and so on. So, looking back, while I hadn't yet hit the point that the scale was kind of tipped and everything fell apart, there certainly were things that set the stage. And I think, the emotional backdrop of a person's life is a huge, huge part of any of these chronic illnesses, and then something that you have to dig really deep to explore and, make sure that you get to a point that you feel that you really do deserve to be well. And, that was a big challenge for me. I had, learned to do some of my own muscle testing at that point, and I would, muscle test for I'm willing to be well, and I would get yes, and I'm able to be well, and I would get yes, and then, I would say I deserve to be well, and I would get no, and I'm like, God, I'm testing myself, and I'm getting no. That's pretty bad. So, right. There was a lot of, I probably worked with a good dozen practitioners just on the emotional front. What is it that I, have internalized that maybe isn't supporting my health? What are the stressors that I'm putting upon myself that are kind of creating that? The other thing that we just in the last couple of years identified that I think also set the stage for this was I had my wisdom teeth removed in high school, and I had developed a dry socket in high school, and of course all they did was pack it with a bunch of antibiotic gauze and those kinds of things, and never thought anything about it again. And 2 years ago, I was working with a practitioner in St. Louis who's just absolutely phenomenal, fantastic, Dr. Simon Yu, and he's written a book called Accidental Cure for those that are interested in, trying to help get their way back from mysterious type conditions. And he was the person who suggested that there were some cavitations or some, infected areas where those wisdom teeth had been removed, and that was another important piece for me to address as well. And so, kind of tying that back into your question, I think it was another thing that happened early in my life, that there was this chronic infection that was already there from the wisdom tooth extraction back in high school that probably had already kind of weakened my immune system's ability to maintain balance. And then once the Lyme came along, combined with all the other stressors of having just moved from, at the time I was living in Texas, and having moved from Texas to California and being here in Silicon Valley in a very high stress kind of environment in a new career, and, working really hard and all those things, drinking 10 free Diet Cokes a day that the office provides for you so you can be caffeined up and working hard. And
exactly.
All that kind of stuff. So, I was aware of, alternative and integrative health and I was already on supplements and things back then. But, no, I think though my health felt relatively good. I mean, I definitely had signs that things were not perfect. I had tremendous problems with headaches during high school and college, and that was a major focus. I had periods where I had, probably stress related, but periods where I had some blood pressure related problems and things along those lines. So I think it's probably unlikely that someone gets exposed to Lyme and was completely 100% healthy and vital before, and then has a really significant challenge with it. I'm not saying it doesn't happen.
Right.
I think when you look back, there's usually some
Stressor,
things that set the stage. Or if you look in people's families, you look at their mom's health or their siblings' health, and they have, multiple autoimmune type conditions or things where the immune system didn't respond to some microbe or toxin or something in an appropriate way. I think you can kind of see that, it may seem like a big surprise, but when you really look a little deeper, and someone like you, who I know is amazing with pulling out all these great functional medicine pieces of information, I know you're probably connecting the dots for people all the time. So.
Right. And I appreciate you sharing that story. And there was an interesting article that came out about 20 years ago in the American Journal of Clinical Nutrition, and the title of the article was "The Synergism Between Nutrition, Infection, and Immunity." And again, it looked at all of these nutritional deficiencies, stress, kind of setting the table up for these chronic infections. So we're kind of like in two places. You can be the person that's not infected yet, but can make a lot of these changes to make themselves more resistant. And then we have the person that's already infected. They're dealing with this infection. They have some of these symptoms. Can you just talk about, there's a couple of main co-infections. We have Bartonella, we have Borrelia or Lyme's, we have Ehrlichia. Can you just go through those big 4 or 5 co-infections, Scott, and then just what are some of the big few symptoms that are going to be correlated with each infection?
Okay, yeah, that's a good question. So I think, in order to talk about Lyme at all, we really kind of have to dig into the co-infections that I would suggest almost universally come with it. I think if you talk to doctors and practitioners that work with Lyme disease, it is a rare person that has Borrelia alone.
Right.
I would say it's almost universal that people have Babesia and Bartonella as well. They may or may not have both of them. But when someone is bitten by a tick or other vector, ticks may not be the only vector for Lyme disease, so that is the focus and the one that really has been proven as a way of transmitting these infections. There's generally multiple infections that a person could be exposed to. So the first one, Borrelia burgdorferi, is the causative agent in Lyme. That's the spirochete that everybody talks about. And then we have other ones, probably the most common ones, Babesia, Bartonella, and Ehrlichia. I would say Ehrlichia is a little less common than Babesia and Bartonella in my experience. I had all of them. And then there are others that are not quite as commonly discussed, but things like parvovirus B19, tick-borne encephalitis virus, Coxiella or Q fever, tularemia. There's all kinds of mycoplasmas and nematodes and other things that these ticks can carry as well.
Right, and just to be clear, Ehrlichia, Rocky Mountain spotted fever, and anaplasmosis are all the same, right?
Well, everything used to be called Ehrlichia, and then it was kind of split out. So Ehrlichia and anaplasma are very similar, and then Rocky Mountain spotted fever is one of the rickettsial organisms, but they are similar. Okay. And then beyond the co-infections, of course, then you kind of get into all the things that people already carried in their bodies, the Epstein-Barrs and other more opportunistic things. And so those are something that we have to think about as well. But if we look at kind of the core microbes involved in Lyme, and I'm always a little cautious because I think people with Lyme tend to hyper-focus on Lyme. It's almost even a bad term because it gives us license to ignore all of the other things that we need to look at to get better, and it gives practitioners license to continue treating those few things when maybe they do need adrenal support or thyroid support or hormone support or a better diet, or they're living in a moldy home. And we'll probably get into some of those things. But kind of back to your question. So Borrelia, the things that often come up are things like joint pain, stiffness, swelling, fevers, chills, some gastrointestinal issues, vision issues like blurry vision. Twitching is a common one, so fasciculations where you just kind of feel little taps in the muscles. I mean, that's a very common thing and can be related to Bartonella as well. Borrelia can be depression, memory issues. Fatigue is a really common one in people that have these kinds of vector-borne, Lyme complex issues. It can certainly affect your sleep. It can create headaches and ringing in the ears. Neck and upper back pain is a common thing. Tremors, some more mental, emotional things like anxiety, depression, light sensitivity. And then once it gets into the central nervous system, which really does not take a long time for that to happen, then you get some of the other numbness, tingling, crawling sensations, burning sensations. I mean, the burning sensations was probably my worst, where you went for, years with what felt like someone having poured acid on your skin 24 hours a day. And I mean, I had a whole summer where I couldn't even put on a shoe or a sock because it just was so painful. And then, the list of Borrelia, if you look, I think there's over 300 symptoms, and they kind of scroll through that. There's a couple of films now, documentaries on Lyme called Under Our Skin, and then they just came out with the follow-up, which is called Emergence. And for people who really want to learn more about Lyme, I think those are great films. They can be a little frightening if someone's just getting diagnosed with Lyme, but I think it's better now that there's the follow-up movie where you can see that the same people in the first movie really have found better states of health and wellness. Because the first movie it is quite frightening when you see how impacted these people are, especially one of the main kind of person in the documentary, Mandy. I mean, she was really, really impaired with Lyme, and today is doing incredibly well. Is working in a hospital as a nurse, and really, I think it changed her life, and now she's giving back. But Bartonella is another one that, quite honestly, I think, yes, Borrelia probably sets the stage for a lot of these things to be more persistent and more chronic. But if you look at the symptoms, I would say Bartonella and Babesia are the ones that really probably create more of the symptoms that people really struggle with. Bartonella, things like anxiety, depression, bipolar disorder. We actually call it Bartonella rage, because people that are the nicest, I mean, I've worked with some people that were, teenage ladies, girls that just seem so nice, and yet, their families would talk about how, they might be like that one minute, and then the next minute they're throwing things at them and breaking things and, breaking dishes and glasses and, all kinds of things. And, it really is just that there's a lot of these microbial issues that can affect behavior as well. I mean, obsessive compulsive disorder can be tied in with Bartonella. I tend to be a little bit on the obsessive compulsive side, which I know you already know, but that can play a role. And then Bartonella also can affect the gastrointestinal system, so lots of gastrointestinal issues. It's very common that people with Bartonella will wake up and say that the soles of their feet are hurting, and that kind of improves throughout the day. You can actually get what looks like stretch marks, but it doesn't necessarily go along the same skin planes that you would expect to see with a normal stretch mark, so they're called striae. Twitching, again, with Bartonella, very common. Light sensitivity, swollen lymph nodes. It definitely has an affinity for the lymphatic system. nodules under the skin, mood swings. And the thing that's interesting about Bartonella is it's really a vascular infection that impacts the endothelium and the lining of the vessels. And so it leads to this small vessel disease and creates impairments in blood flow throughout the entire body. So any symptom that you could get as a result of having an impairment of blood flow and circulation to any part of the body potentially could result from Bartonella. So I think Bartonella maybe is the one that is creating more of the symptoms for a lot of people, and it's also probably more challenging to treat than Borrelia. At least that's been my observation. Babesia is another big one. That one creates let me step back on Babesia, a little bit different. So Borrelia is spirochete, kind of a bacteria. Bartonella is a bacteria. Babesia is actually a parasite, and so it lives in the red blood cell, and it's kind of a cousin of malaria, and it creates things like headaches, night sweats or day sweats. So you'll talk to people that they're literally drenched at night while they're sleeping, and they had to get up and change their night clothes or their sheets or whatever several times just because the night sweats are so significant. Air hunger is a common one that you just feel like you can't get a deep enough breath. Sometimes people will have the little red dots on the skin. The cherry angiomas can be a factor in Babesia as well, though both Bartonella and Babesia can create a whole list of skin-specific presentations. Babesia can also cause ringing in the ears. A lot of people will have a cough, a really chronic dry cough that lasts for long periods of time, or flushing sensations, in the face and skin and those kinds of things. Ehrlichia then, or anaplasma, I would think of things like fevers, fatigue, headaches, pain, and then low white blood cell count is a common one with Ehrlichia. Well, that can be a factor in Lyme overall. When the white blood cell count is low, that's maybe a reason to also think about Ehrlichia. And I think part of the challenge is, when you have one of these infections and you can kind of map it to one list of symptoms, well, it becomes pretty easy, but that's usually not the case. Usually you have such a significant overlap in not only these infections, but the parasites, the viruses, the mycoplasmas, the fungal yeast, candida type organisms, and so on. And so when you start kind of looking at all the overlapping list of symptoms, it's really difficult to take symptoms and lead that to a conclusion of, which infection is driving it. And then you have the additional complexity that you look at the list of things for heavy metal toxicity, and you look at the list of things for mold toxicity, and so many of the symptoms overlap the same things that we just talked about for these vector-borne infections. So it's really hard to differentiate just by, the symptoms.
Exactly. So there's a lot of different questions here we can ask based on each of these. We're going to have to definitely have you back for a part 2, because I know we're going to really want to get in deep on this. I know this is a huge epidemic, and based on that, can you just talk about how common these issues are? I mean, we talk about Lyme disease, and you hear people at the CDC or your conventional MD saying, well, that's not endemic here. That's only in maybe the upper Northeast in Lyme, Connecticut area or some area in and around there. Can you talk about how common these infections are, and then where in the country we may find these?
I think you can find them pretty much in every state at this point. I read something recently that said that there have been people in all 50 states that have been impacted by Lyme. There certainly are people that would question whether or not they contracted it in those states, or they maybe got it somewhere else, traveled to Nantucket or somewhere back east and just happened to be back in those states. But I know people that had very, very difficult decade-plus long journeys with Lyme that were infected in Hawaii, and most people don't think of Hawaii as a place that you would get Lyme. Most people don't think of California as a place that you could get Lyme, and in fact, Northern California specifically is one of the areas that has a very significant number of people dealing with Lyme. It's not just the East anymore. It's not just the United States. I mean, if I look at all the people that kind of track what I'm posting and stuff on my Facebook page, there's many, many different countries, lots of European countries. I've talked to people in Brazil. It's a very common problem in people in Brazil as well. And I think the the number of people that know that they have Lyme, in fact, the CDC revised their estimates not too long ago, suggesting that it was probably 10 times more than what it had been in the past, and I believe they'd suggested now up to 300,000 cases a year, which I think many people that are treating people with Lyme would probably suggest that that's probably underestimated. And if you then look at people with other conditions that I'm not one to suggest that things like MS and Parkinson's and ALS and all those are Lyme disease, but I would suggest that those are conditions that have a component of infection, a component of toxicity, and a component of everything else that Lyme has. And if you look, many of these people with multiple sclerosis and Parkinson's and ALS and neurodegenerative conditions, even Alzheimer's, Lyme may have been a factor. And so the question is, how many people maybe have had Lyme that never got diagnosed and they live with it as a stressor that their body largely balances and is able to maintain some sort of a state of health for years and years. And as they get older, maybe they have another one of these conditions and then they get tested for Lyme. And in fact, they also had Lyme. Now, whether Lyme was the driving factor or not, it's difficult to say, and probably, in all of those cases, it's probably not. It's probably a host of things. But fibromyalgia and chronic fatigue as well. I mean, I've known so many people. In fact, before my Lyme diagnosis, I was diagnosed with fibromyalgia and I was diagnosed with chronic fatigue syndrome. And while there are some unique presentations in those illnesses, there's also a lot of overlap in that infections are common, toxicity is common, and if I know a number of people that really identified more with fibromyalgia and chronic fatigue in the past. They got tested for Lyme, they got tested for co-infections. Sure enough, they had Lyme, they had co-infections. Doesn't mean that that Lyme is their sole issue, but unfortunately, I think what's kind of happened is a lot of these things have become labels, and they're just slightly different variations of labels that represent some combination of bugs and some combination of toxins and some probably epigenetic and genetic factors that are involved in your immune system's response to how the body reacts to these things. But I do think that there's a number of people out there where Lyme is one of the stressors that their body is dealing with, and the co-infections as well, that don't even know about it. There's been some research done by Judy McCloskey, and also separately some research that was done by Alan McDonald, who is one of my heroes, and I've met several times, and just amazing what he's done for research around Lyme disease. And they have both talked about finding the DNA of spirochetes in the brains of people with Alzheimer's. And those, in some cases, maybe Lyme, and in some cases, maybe other spirochetes like Treponema denticola, which is a fairly common dental spirochete. But, a lot of these conditions that are neurological, I think more and more we will find that, infections and toxicity play a huge role. So, and it's interesting too. I think it's still highly debated in terms of, the Infectious Disease Society of America has one perspective on Lyme, which is that it's difficult to get and easy to cure. And the ILADS, or International Lyme and Associated Diseases Society, has a different perspective, which is that it's relatively easy to get and relatively difficult to cure, especially after some period of time where it's really not in that acute stage anymore. And I think that there is a lot more awareness around Lyme disease now. We're seeing more and more discussion about it in the media. When I first got sick, Google didn't even exist. There were very few online support groups like there are now.
Exactly.
There was very little talk about Lyme disease. I don't even know if there was an ILADS yet or a LymeDisease.org. I'm not sure when they came into the picture. They've both been around for quite a while and do some amazing work. But the awareness about the disease is certainly increasing, and I think even more recently where we see celebrities that are finally starting to speak out. There's a number of them that for years there's been talk about certain celebrities having potentially had Lyme disease. There's been talk about Alec Baldwin as one potentially. There's been talk about Richard Gere. I mean, there's been talk a lot over the years of people that Lyme may have been an issue for them. But now we know Yolanda Yolanda Foster, who is married to David Geffen and one of the Real Housewives of Beverly Hills. I mean, she's had a tremendously difficult journey through Lyme, and I think she's probably, as a result of her journey, going to make some very significant changes, because she's really, she has the resources to go out and really explore a number of different types of treatment options, and hopefully as a result of that, some things will come out of it that will make things easier for people that are dealing with Lyme in terms of accessing treatment. Avril Lavigne just came out.
I just saw that on your
week.
Facebook. Yeah, Avril Lavigne. I saw that one too.
So apparently she had struggled with it, I think, for almost a year. I believe it was last April that she started getting sick. And, none of her fans or anything really had any idea of, she had pretty much just completely gone off the scene, and no one was really clear what was wrong with her. And so she just finally came out. There was a good article, I believe it was People magazine, talking about her story. And, it sounds like she's getting back to a better place. Debbie Gibson was another one last year who, singer as well, who had a very significant journey with Lyme. And so I think there is more awareness. There certainly is still somewhat of a political divide in terms of, how to approach treatment. Some people suggest that if you do antibiotic therapy for 28 days and you are not well, that what you have is something called post-Lyme disease syndrome, which means you don't have infection anymore, and we don't know why you have symptoms, but we kind of gave it our best shot, versus someone who would suggest that there's many studies that show persistence of infection in animal models and others that have been treated for long periods of time with antibiotics, and that these bugs are still there. And so that kind of group of people would suggest that longer-term treatment is beneficial, and that people do continue to improve with antibiotic and other treatment. When I first got ill, when I first got diagnosed, was 8 years into having been ill, so 2005, there was not a lot out there in terms of treating Lyme disease. Mm-hmm. The option then was antibiotics, or antibiotics. You pick which one you want, right? That was kind of what I had. We did not then have Stephen Buhner. Just came out with his first book, Healing Lyme, in 2005, the year that I got diagnosed. There was just the very beginnings of something called the Cowden Protocol from Nutramedics. I think Cemento existed around 2003.
Right.
We didn't have Beyond Balance formulas. We didn't have Byron White formulas. I mean, we didn't have any of these tools that we have now. And so while I definitely see people that work with their doctors and do need antibiotics, there are certainly some people that the natural herbal integrative options just don't seem to be enough to manage their symptoms. I would have done things a little bit differently now, which is maybe I would have still done antibiotics, because I did get some pretty significant symptom relief, especially in those neurological burning sensations within the first 6 to 9 months. They pretty much resolved. So I may still have done some antibiotics, but now there's so many options out there, and I think especially for people that are not quite as deep in the hole as I was when I first started getting treatment. I mean, if they're relatively functional, I think there's so many options out there now: integrative, alternative, herbal type, homeopathic type options. And I know you're familiar with a lot of these things, and I think the beauty of those things is you can move things forward, but you aren't necessarily having some of the same collateral damage, right? So once you've done, one of the challenges for me even to this day is being really cautious and careful about diet, doing all the right things to continue to support the gut and so on, because after you've been on antibiotics for 3.5 years for every day, you can only imagine that your gut flora is probably not in the best shape.
Exactly. So on that note, I want to shift the conversation just a little bit to some of these options here. And even before that, we kind of have like the classical conventional diagnosis from the CDC, 5 IgG bands, 2 or 3 IgM bands. And then we have this kind of alternative diagnosis. And then we have people that aren't even coming up positive on testing, and we're maybe using a more energetic test like Dr. Klinghart's ART or a muscle testing type of energetic technique to diagnose these things, or even just symptoms. Can you just briefly just compare conventional versus the alternative testing versus energetic testing?
Yeah, so I think I think conventional testing is certainly important and appropriate. So I would not suggest that somebody, avoid doing some of that more conventional testing, because I think it is important for many people to see, on paper that, oh yes, look, I do have some really significant issues here that I need to deal with. So doing the, IGeneX Western blot, I think is a very good thing to consider. Doing their panels for co-infection testing, I think, is a great thing. To your point about, the criteria being a little bit different, IGeneX looks at some bands that the CDC does not, so 31 and 34 specifically, that are not part of the standard conventional Western blot anymore, because they were used as part of vaccine development for the Lyme vaccine, which was taken off the market over 10 years ago now because it created problems for some people. And so that's unfortunate, because that is two of the outer surface proteins of the Borrelia spirochete, and, most labs that do Western blot testing don't look at those or don't report them, and so you're missing some really key information. The other challenge is, as you pointed out, the criteria for CDC positivity is quite high, meaning 5 IgG and I believe 2 IgM. But there are bands that can be indeterminate, meaning they saw something. And if those bands where they saw something were Borrelia-specific bands, meaning there's nothing else that's known to cause those specific bands to appear in the test, then it's kind of like being a little bit pregnant, right? I mean, how does, you can't be a little bit pregnant. So I think when those tests come back and there's some indication, yes, it's not a clear diagnosis, but Lyme disease is a clinical diagnosis by, a licensed healthcare practitioner. And so, oftentimes they use symptoms and the tests to kind of try to put the puzzle together. I think for co-infection testing, I mentioned IGeneX. I think it is good to do their co-infection panel. I think right now for Bartonella, there's a lab called Galaxy Diagnostics, which I think is worth exploring. I don't think I'm not aware of a real specialty lab for Babesia at this point. There is Fry Laboratories as well, which I think they do some Babesia testing, but they do a number of very unique stains, looking at things like biofilms and protozoan organisms, which are parasites that also play a role in many people that have these chronic conditions. So I like IGeneX, I like Fry Labs, I like Galaxy Diagnostics. There's probably some others. I actually like the Borrelia culture test from Advanced Laboratories. I know it's been attacked a bit, but I think they have an interesting approach. And part of the challenge with some of these tests is if your immune system is suppressed and you're looking at antibody type responses, you may not have a positive test because the immune system is no longer able to respond, or because these organisms are so stealthy and sleuthing in the body that they know how to avoid immune system recognition. And so sometimes it's good to do tests that are not only the antibody type testing, but also tests that are looking specifically for the organism, which are things like the Advanced Labs Borrelia culture test, or the enriched PCR test that Galaxy does for Bartonella. Those can be good. I also think that while CD57 is not a good tool for kind of tracking improvement in my experience, and it is not specific to Borrelia, there are other things that can also cause it to be low. I think
Like what?
Some people would suggest that mold illness can cause CD57 to go lower. Some people would suggest that being in a significant Herxheimer reaction, being in a state of inflammation can cause it also to go lower. Some people would suggest that co-infections can also cause CD57 to be lowered.
Anyone specifically, like mycoplasma or anything else?
I know chlamydia pneumoniae is one of them that I've heard some lectures on that could impact CD57. So I think it's a good tool at the beginning to see, if someone has a CD57 of 150 and you're trying to decide do they have Lyme, maybe that's an indicator that, you're not looking in the right place in some cases. But, if they have tests that are somewhat consistent, you're getting some indications that there are infections and their CD57 is 20, then, they definitely have something going on that needs to be looked at further.
And that's a marker I run a lot with my patients too, and I don't ever, use it as a means of diagnosing anything, but it's interesting to run over time as you treat someone to see it go up. And that's an interesting thing, seeing the immune system improve. Do you ever use that just as to run when you're treating someone to see if it's moving in the upward direction?
I have not found it to be an incredibly reliable marker. And I think over time, some of the people that really were using it a lot have used it less over time. However, there are some practitioners that I know, one in particular that recently was talking about seeing fairly consistent increases in CD57 once she started treating parasites in her patients.
Yes.
And, so I think there are some things, but I also know people that feel fairly well, that they get to a point that they're largely symptom-free, that they're not on significant protocols anymore. They may still be on some maintenance protocols, but they feel like they've gotten their life back. And the CD57 may not necessarily represent that, or the opposite, people that still feel miserable and are largely bedridden, and maybe they have a CD57 of 200, and, what does that mean? So
exactly,
I think there's very little in Lyme disease that is clear, and you have to use each of these things as a piece of information, and that's where I think you're really good. And I've watched lots of your videos and things that you've put out. I mean, you're really putting pieces together and connecting the dots, and that's the kind of mind that it takes to deal with these chronic infections, right? It's
right.
It's challenging. And then so that's kind of my thoughts on the conventional side. And then you
I just want to stop you right there, but just before we transition off. If anyone has already run their Western blot and maybe has their bands in front of them that they can look at, what bands would you say are the most important? Like, let's say they have an IgG and only 2 bands show up or 3 bands show up, and it wouldn't even, be classified under a alternative criteria. What bands are the most important for you that would say, hey, there's a problem here?
The ones that I would think about as being fairly clear indicators for Borrelia would be 2325, which generally is reported as 1, 31, 34, 39, and 8393. Now, there is some talk that 31 in some cases could have some cross-reaction with some some viruses in the system as well. And so if that's the only one that comes up, there is a confirmation test that IGeneX offers where they can take it one step further and see, was that positive band the result of some viral cross-reactivity or not. But generally speaking, those bands are the ones that, if you look at Dr. Rich Horowitz's book, which I really at this point consider to be kind of, the Bible of Lyme disease treatment. And I think that, anybody that is dealing with Lyme should, get his book and really read it and digest it and work with their practitioners. It's called Why Can't I Get Better? Solving the Mystery of Lyme and Chronic Disease. And it's a fantastic book, but he talks about, if you have any of these bands, that it's like bingo. And, if you have one of those bands, then bingo, you may have Lyme disease. And so those are probably the ones that I would say are worth looking at that are more Borrelia specific. There's other ones like band 41 will come up in almost everyone, but that's not necessarily Lyme specific. That again can be tied to, I think, any organism that has a flagella, can be a dental spirochete or a host of other bugs. And so 41 is not really a very good one generally to look at.
I think you have an excellent blog post on this exact topic, don't you?
I do, yeah.
Great. So definitely check that blog post. It's one that I have actually saved in my library that I refer back to. Very good one.
Cool.
And then I wanted to touch upon one thing here for anyone that's diagnosed. What's the intensity cutoff for you? So if anyone's looking at their test and they're seeing the intensity, are you looking at 60 and above, 80 and above? What's your intensity cutoff for flagging that band?
Well, the bands are usually reported, at least on the IGeneX testing, the bands are usually reported as indeterminate, or they'll be reported as 1, 2, 3, or 4 pluses. And even if something is indeterminate for a band, that means they saw something, which oftentimes might suggest that the immune system was having a response, but it wasn't able to mount an adequate response. And so a lot of times in the Western blot, some practitioners will treat for a period of time, maybe a few weeks, just to start kind of going after some of the organisms and getting the immune system to be a little more responsive. And then they might might repeat the Western blot, and in that case, you might have a much more clearly positive test. So in cases where it's suspected but the Western blot is not really clear, doing some treatment and then retesting oftentimes will then show you a different picture, because the immune system starts responding to these organisms now that the treatment is killing, and as it's kind of moving them through and out of the body. So I think that's something to consider. You asked a little bit about energetic testing as well.
Yes.
So from my perspective, energetic testing, I don't think of it as a diagnostic tool. I think of it as an informational tool, kind of a decision support system that practitioners can use as additional information to then go off and either run some additional conventional test or to do some empirical treatment to see if a person feels better. For me, that really became my biggest guide. And I mentioned that the very first person that ever mentioned Lyme to me was someone who did electrodermal screening. And so I then started mentoring with Dr. Dietrich Klinghardt up in Seattle, who has really been my biggest mentor throughout this journey. I've been following his work for almost 10 years. He was my doctor for many of those years. And he has created a system of energetic testing as well called autonomic response testing, which is a more manual muscle testing based system. But it's a phenomenal system. The information that you can get out of working with a practitioner who does, that system or a similar system, I think is pretty significant, both in terms of what are the microbial stressors that are potentially impacting someone, what are the toxic stressors, metals, mycotoxins, those kinds of things, or what are some, supplements or herbs that might better resonate with this person's system. And so it's not a perfect system. Nothing in Lyme is perfect, but my experience has been that using energetic testing and working with skilled practitioners that know how to do energetic testing got me closer to information that really kind of guided me back to a much better state of health. And so for me, ultimately the energetic testing became a more useful source of information than some of the conventional testing, but then marrying the two together was really the beauty, right? That was fantastic. So I do think energetic testing can be great. I think, unfortunately, not every practitioner is, equally skilled with it. There are some practitioners that probably, have been doing it for decades and are phenomenal, and maybe others that are not quite as skilled at it. And so, finding the practitioner, if you've had an experience with energetic testing that didn't resonate with you, there's always the possibility that finding another practitioner, you might have a very different experience. But I also like some of the computer-based tools. Like there was a tool that's not quite as available anymore, but something called the Asira. There's a tool called the Zyto that is still a tool that lots of practitioners use that can measure somebody's it's through galvanic skin response or electrodermal screening, can kind of measure somebody's response to something that represents a specific stressor. And so like the Zyto, there's a little kind of oversized mouse thing that somebody plugs into their computer, and then you can do a scan and not only try to identify what are the potential stressors for this person, but also what are the things in terms of supplements and other, anything, essentially any potential treatment that might be good to consider for, a particular person. Dr. Lee Cowden is someone who's been very, very much into using the Zyto and has really talked and lectured about it for many, many years now. And so I think for me, energetic testing was kind of a turning point. It was very, very helpful. I don't think I would have gotten to where I am now without it. And while I'm generally doing very, very well and consider myself today to be a well person, there are times that you still feel something is kind of not exactly right. And so I tend to now turn more to the energetic testing first to figure out, okay, what is it that I need to be doing more of or less of, or, shifting my diet or whatever. So I feel more empowered, and I think many patients throughout this journey, unfortunately, you kind of have to become your own advocate and your own kind of guide and align with practitioners that can support you in that kind of journey. But you do have to kind of get out there, educate yourself, make some hard choices and changes about your life and lifestyle and levels of stress and exposure to electromagnetic fields and exposure to mold in your environment. I think the mold one, I mean, it's such an important thing that many people that I've talked with over the years that were not getting well, they had Lyme, they were treating Lyme, they start looking into the whole mold world, and the work of Richie Shoemaker, survivingmold.com, and the books Mold Warriors and Surviving Mold, fantastic discussions about mold. And it's surprising how many people in this country are living in an environment every day that is essentially toxic. And if they're in one of those environments, you can take any supplements, antibiotics, do anything you want. But if you're basically in a bubble every day that is not healthy for you, it's going to be very, very difficult to recover. And so
Right.
I think most people that have these chronic conditions, even if you don't think there's mold in your house, I mean, it's a very, very straightforward thing to at least do some initial testing to see, is it possible that I do have a mold exposure? And we didn't really talk about it, but that was part of my journey as well, right? I mean, 10 years that I was living in a place when I finally found out about the Lyme, finally came out with, Richie Shoemaker came out with his book, Mold Warriors, around 2005, I believe, maybe 2006, and dug into that whole issue. And sure enough, I had been living for 10 years in a place that had all kinds of mold exposures, from leaks in the roof, black mold, all these other things. And so, getting out of that environment was also a big part of recovering. It's not just about the Lyme pieces, but there's so many other factors that you have to kind of add as many good things and remove as many bad things so that your body can do what it's naturally intended to do. I mean, the body is a beautiful, remarkable, wonderful machine, but we have to sometimes not bog it down
Right.
with all of these stressors.
Right. So let me just kind of summarize, because we're going over a lot of stuff. I want to make sure people aren't overwhelmed. So we just went over some of the testing, right? We talked about the CDC type of criteria, 5 bands, 2 bands, 5 for the IgG, 2 or more for the IgM. We also talked about some of these alternative labs. We talked about Galaxy. We talked about Fry Labs. We talked about Hygienics. These are great labs that have even more sensitive criteria. And then we also went over Dr. Klinghart's technique, autonomic reflex technique, and then Dr. Cowden's device, the Zyto. So a lot of different cool things that we can use to subtly pick up if these stressors are there. And then we can start applying some therapies to get better. So on that note, Scott, like you mentioned a lot of different supplements. You mentioned antibiotics. So if someone has Lyme's off the bat, or Lyme, I always pronounce it plural. I know, I think everyone does that.
They do.
I know. I remember every time I'd say Lyme, she's like, you mean Lyme? I'm like, yes, Lyme.
At least you caught yourself because you saved yourself from a correction.
Yes. It's named from Lyme, Connecticut, and we can always get into all the conspiracy theories of it in a later episode. But you talk a lot about these herbs, and I know you really have kind of like your pulses on all of the best herbal companies to start treating some of these infections. Can you just go over some of the alternatives? Someone comes back with one of these infections. What would be the first couple of things you would do?
Well, I mean, I would try to reach out to someone that can provide some of the energetic testing insight.
Yeah.
But in terms of companies or products or things that I've really found helpful and still kind of use, I mean, I'm still doing maintenance treatment. I still have things that I want to work on and improve, but, I'm hugely, hugely better. I would say I like a company called Supreme Nutrition, which is Michael Leibovitz is a
he's great.
chiropractor behind that, and the quality of their products are wonderful. The cost of their products is very reasonable, and I think they've kind of created a whole energetic testing system where they use those products, and I think that can be really nice if people can access a practitioner doing that work. I like a company a lot called Beyond Balance. They have glycerin-based blends that are beautiful, that help with, the Lyme-related infections, the co-infections, viruses, detoxification, parasites, all of those things. And I've used them for personally, I've used them for probably 7+ years now, and I think that they're very well put together. The naturopath and herbalist that creates them, Susan McCamish, she created them essentially to get her own 10-year-old son out of a wheelchair, who for many years was ill, and then they discovered that Lyme was the reason. And today he's perfectly functional and getting ready to go off to college and doing fantastically. And so that kind of came out of her passion for her own child and has really helped a number of people. There is a company that I like called Maypa Herbals, Maypa Herbals, and that herbalist has some beautiful products. And what's interesting about those products is I don't often hear people having huge Herxheimer type die-off responses, but I do often hear that people feel better on them. And so there's a formula for Lyme and a formula for Bartonella and Babesia and viruses and Candida type organisms. So I think that company is great. A number of people also like the Byron White formulas. There's some very powerful medicines as well.
Like Byron White. Yeah.
Yeah, so those are fantastic. But I think it's important too for people to not focus just on the microbial issue, right? I think when I started out, my way of thinking about things was that infection was number one, toxicity was number two, and emotional traumas and conflicts were number three. And now, almost 20 years later, I would completely reverse it and say that emotional traumas and conflicts are number one, toxicity is number two, and infections are number three. And it comes back with the infections a lot to the terrain. And if we're completely toxic with heavy metals and mycotoxins and all these other things, it's going to be really hard to get the infectious burden to be reduced. And Dr. Klinghardt, I have an article that Dr. Klinghardt and I wrote a few years ago that's also on my website that talks about what he calls the Klinghardt axiom, which is that you really have to work on the infections, toxins, and emotional issues kind of simultaneously in order to maintain the progress that you're making. If you're only focused on one of them, that when you take your eyes away from that, it essentially will kind of go back to a state of equilibrium with the others. And so things to support detoxification are really, really important as well.
And what are some things that you recommend for people just to kind of get their emotions and maybe past trauma under control? Like, do you just like things like meditation, mindfulness, maybe tapping techniques to help resolve hidden, maybe brainstem kind of how should I say it, sympathetic responses where people are just locked in this sympathetic response because of past trauma? Right. What kind of things do you recommend that someone could do, or techniques that you recommend looking into to help address these unresolved emotional issues?
So there are some things that I think are great that need to be somewhat practitioner guided. There's a whole system called family constellation therapy that Bert Hellinger created. Dr. Klinghardt does a lot of that work, and it's very interesting. And I have done family constellation work myself throughout my journey, for my own kind of recovery. There are systems like applied psychoneurobiology or psychokinesiology, which Dr. Klinghardt has created, that kind of deal with the emotional work. EFT, I think, is a good option for people. Any of the tapping systems can be great. There are a couple of specific practitioners that I often refer people to when they're really kind of dealing with the emotional work. Amy Scher is one who had her own journey with Lyme disease, did stem cells in India many years ago, and recovered, her symptoms completely resolved except for a specific thing she was dealing with, which was endometriosis, which got significantly worse. And so it didn't make sense that everything else had resolved except for this one issue. And so she spent a number of years looking into all of these different emotional systems and resolving that eventually by doing the emotional work, and now has become a beautiful practitioner working with people every day, dealing with trying to help them through some of these emotional challenges. I think that there's a system called EVOX, which is from the same company that does Zyto, that Dr. Cowden uses a lot for perception repatterning or reframing, and kind of the way that one works is by taking a voice sample, looking at frequencies that are missing in your voice, and then determining what frequencies the body needs to be given in order to kind of shift that emotional block or emotional stressor. I think some of the Bach flower or bush flower remedies can be wonderful, some of those tools for helping to support the emotional layer. And then for people that are really more into the, kind of anxiety, what you mentioned, the sympathetic overdrive, there's one that I'm just starting to explore, and so I don't have a strong opinion about it yet, but I've gotten some very, very good feedback from two other practitioners on this device. It's something called Mind Alive. mindalive.com is their website, and it's an audio-visual entrainment with cranial electrical stimulation. And so you have the glasses and the headset, and it has a number of different programs to kind of shift the brain into alpha, delta, different places of deeper relaxation. And
That's
I think
great.
that, and it's a fairly inexpensive tool, like, $500 or something. And I think that I've used it a couple of times, just got it a week or so ago, and I've used it a couple of times in the last week and found myself kind of conked out, snoring on the couch. So it clearly has some usefulness, I think, for kind of calming. There's other tools, I think, too, that can help get people into that kind of parasympathetic state. I mean, I like the biomat, which I think we've talked about before as well. So there's a lot
of the biomat that has the amethyst crystals, and that has healing kind of blood flow properties to it.
Yeah, it's the amethyst crystals, the far infrared heat, and the negative ions as well. And I mean, I do use it a lot. I mean, no tool is going to solve everybody's problem, but I think that having some tools that we can kind of bring in, and I think kind of creating a space or a room or something in your home that's kind of a meditation or a safe sanctuary kind of place where we can use some of those tools and do some of that work is great. But I do think that if you didn't have emotional challenges before you got Lyme, most people will have them as a result of the journey of going through Lyme and being told that they're crazy and that their problem is not real and all of these other things. And so it is a very difficult journey for some people, not everyone, but I think the people that have had it for many years, it does take a lot of work to get well. But I see it fairly regularly that people that are doing the right things do get better. I think there's a lot of hope. I think there's so much good information that's coming out now. Stephen Buhner now in the last year has come out with 2 new books on co-infections. I mean, his work is phenomenal. So I think there's many reasons to be hopeful, and I think that Lyme disease really is a messenger for many of us. I think that the process of going through it really is life-changing, and it is certainly probably the biggest challenge that I've ever faced in my life, and probably the biggest challenge that many people will face. But I also think that it's important to look at some of the beautiful things that come out of it, some of the friendships that emerge, and some of the insights that people get, some of the perspective, some of the way that you've changed your way of looking at the world. It kind of forces us to step back and look at what's important and the people in our lives. And it's a difficult journey, and yet so many good things come out of it as well. I'm not sure that I would want to kind of snap my fingers and have it go away, because I'm a completely different person now coming through the other side and out the other side of Lyme disease. So.
Right. And I want to urge anyone that's listening to this that maybe has a chronic health issue or thinks they have Lyme or a Lyme co-infection to seek out a practitioner like Scott or like myself. Again, Scott is available in the Bay Area, Silicon Valley area for consultation, but you really want to see someone that can help prioritize a program, that can look at your diet, look at stress, get everything dialed in so you have a foundation to start addressing some of these infections, because it can be very stressful on the body to treat these infections. And if you just go out and buy a whole bunch of herbs and throw it inside your body thinking that it's going to fix the problem, you may actually even get more sick. So just be mindful of that kind of disclaimer there. Make sure you're working with someone that can help get the foundation dialed in. Is there anything you want to add to that, Scott?
I think that if someone's dealing with Lyme, reaching out to ILADS, ilads.org, and looking for a doctor there. I do some health coaching work, but I generally work in conjunction with a medical doctor that is kind of supervising the overall care. So I just want to kind of throw that out there, that I'm not, not trying to really get too much into the treatment realm. But if someone's working with a doctor and would like some coaching type work, that's something that I could certainly potentially help them with as well.
That's great, Scott. And how can our listeners here find more about you? I think you said betterhealthguy.com. You got a really big Facebook following too. Can you give everyone your stats?
Yes. So betterhealthguy.com. So betterhealthguy.com. And on Facebook, facebook.com/betterhealthguy. The Facebook page tends to be where I post things that I just kind of see every day, articles and interesting things, and then the website a little bit more, blog and article focused, probably not quite as frequently updated, but there's a lot of stuff there that I've collected over the years and articles that I've written and things for, different publications and whatnot that I think will help people as well.
Yeah, and I'm always referring back to Scott's site for anything Lyme related because there's so much information there. And by the way, Scott, how do you keep up with your Facebook page? It's like every hour there's a new post up there. How do you do that?
Well, I guess it's good that I'm good at multitasking.
Good answer. I like it. So, Scott, we're definitely going to have you on for a part 2 because there's so much to dive deep into. You just wrote an article for the Townsend newsletter that should be published any day now. The time everyone listens to this podcast, it'll probably be up, and that's on Bartonella. And I imagine if they just Google Townsend newsletter, Bartonella, and your name, Scott Forsgren, they'll probably find that article. Great article. And I love how you finish at the last page or two where you really emphasize looking at the adrenals and the diet and the stress, which we kind of emphasize in this call, which I like that a lot. So take a look at the Bartonella article on the Townsend newsletter. And then I want to end this call here, Scott, because we're going to have you back for a part 2 later on this year if you would be open to coming back.
Absolutely.
But I want to end my my calls here with all these last 2 questions that I'm trying to ask every practitioner or every interviewee here. If you were stuck on a desert island, Scott, and you only could bring one herb or one supplement, what would it be?
I would probably say Takasumi Supreme.
Takasumi Supreme Nutrition.
Though with the caveat that if I'm on an island that is not highly toxic, then I may not need it. But
yes,
in terms of being a fantastic toxin binding tool, I've found that one to be very, very helpful for me and other people as well.
Takasumi Supreme. And for anyone listening, that's like a bamboo wood extract. That's from Michael Leibowitz's company. Great product. Awesome. Yep. And then if you were recommending 3 things that anyone could do, don't have to have Lyme's, but just in general, 3 things that anyone could do to help improve their health, what would those 3 things be?
I would say reducing stress. It's a much bigger factor than I think we realize, and something that I still have to consciously work on every day to, focus on, especially when it comes to the effects of adrenals and whatnot on overall health. So reducing stress, improving the diet. So not really reducing, but eliminating gluten, dairy, reducing sugar, anything that you're known to be allergic to, reducing pesticide exposure. I think that's really, really important. And then I would probably say making sure that the environment that you're living in is safe for your health and or recovery from a perspective of either mold exposure or ongoing electromagnetic field exposure, which may seem like not such a big deal, but when you really look at the impacts on electromagnetic fields and cell phones and cordless phones and wireless internet and all these things on health, it's often a factor that once reduced or removed, that people's health often takes a positive forward step.
Yeah, and your story is very similar to Dave Asprey's story with the whole mold toxicity. So it's interesting how these common threads happen with these chronic disease situations.
Absolutely.
Well, thanks so much, Scott. Is there any last bit of information you want to share with the listeners, websites, anything else?
Sure. I'll mention one foundation. I know a lot of times people that are dealing with Lyme disease, it's a financial struggle. They've spent a lot of money. And so one foundation that I work with, I'm on the board of a foundation called Limelight Foundation. And the website for that is limelightfoundation.org. And the purpose of that foundation is to support treatment for children and young adults 25 and under. And so we provide financial assistance for people that can't otherwise access care. And it's been such a positive experience for me to be involved in, seeing the things that happen when people's lives, change and improve because they're able to access care. And so if anybody is either in a position where they have a family member or themselves that are 25 and under and need access to care and financially can't get that, then then looking at limelightfoundation.org may be helpful, or if this resonates with someone and they're interested in talking with the foundation about providing support or financial support to continue our mission, that would be great as well. So I think that would be a good resource for people, limelightfoundation.org.
Awesome. Thanks so much, Scott. We appreciate you coming on the show.
Thank you, Dr. Justin. Be well. Thanks.
Thank you.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.